Bringing a child into the world is one of the happiest moments in many parents' lives. Parents begin to articulate their hopes and dreams for their new child and are excited for their arrival. Some babies need support to meet their developmental milestones or are born with a specific diagnosis and developmental delays. Doctors will recommend that parents seek early intervention services for their new loved one, a program that wraps the family and child in much-needed support. Early intervention services assist the family in developing strategies that focus on those hopes and dreams. While some need the service only for a short while, others will discover their child has a lifelong disability. And so it begins, navigating the essential yet complex world of support services. After early intervention, children with disabilities begin school, and the focus shifts primarily from the full family to the child. Many strain to adapt and thrive outside the family-centric approach they first experienced, and services are no longer centralized. It can become challenging for many families to coordinate and manage multiple program enrollments. But thanks to advances in inclusive education, many children do make progress. As the child graduates and grows into adulthood, they transition from the school system to the adult system, which calls for more program coordination and enrollments. The first hurdle is the availability of funds and a limited number of funded service slots in adult services. Once a spot is available, families often encounter two additional obstacles. 1. There are gaps in service models for the many young adults with multiple challenges. 2. Coordination among agencies is often challenging. Within the current system, there is no active funding for the creation of new approaches, so gaps will remain. In addition, over 80% of providers of adult services are not accepting new people to support due to a dire national workforce crisis. If an opening is found, quality challenges begin with provider staff turnover. Typical turnover rates are over 50%, so essentially half the staff who started to support the person are likely gone within 6 months. But it doesn't have to be this way. These challenges call for a fresh approach and a new vision of how care and support services can be wrapped around the individual and their family. By creating new services and payment models, we can better use the opportunity provided by the Medicaid Home and Community-Based Services Program, or HCBS, to overcome every hurdle. HCBS can enable us to envision the whole life of the person clearly by identifying their hopes and dreams. We can help set a new course for a meaningful life with the right community supports in place. To accomplish this transformation, providers, families and advocates, and policymakers need to work together. Speak up, share your story, and let's make change happen because care can't wait. This message has been brought to you by KenCrest, a leading provider of support services to people with disabilities and their families in Pennsylvania and in Delaware and Connecticut. To learn more about the many programs they offer, visit kencrest.org.